In this video, you will learn how to perform an arthrodesis on the DIP joint using the minimally invasive technique and the shark screw allograft, with maximum protection of the fingertip and tissue. Open the DIP joint via a short Y-shaped skin incision. Underneath, the extensor tendon is cut obliquely so that it can subsequently be sutured back to the distal residual limb to cover the arthrodesis. Removal of the exophytes with the lure and cutting of the collateral ligaments is performed, allowing maximum flexion in the DIP joint. Osteotomy is performed with the lure or with the oscillating saw. This is best done with maximum flexion of the DIP joint. The distal extender tendon stump must be pushed off the distal phalanx a few millimeters in the process. Break through the sclerotic bone of both DIP joint surfaces with a K-wire or a thin drill. Check the position of the osteotomies. Place a 1.2 Kirschner wire centrally intramedullary in the middle phalanx, over which the core drilling and tapping for the matching shark screw will be performed. In this case, you should use a 3.5 mm shark screw cut. Drilling and tapping is done with the blue drill for the 3.5 mm shark screw cut. Next, insert a 1.2 Kirschner wire centrally from proximally into the shaft of the distal phalanx. If needed, drill it centrally through the tip of the phalanx. Now drill a core hole for the 3.5 mm shark screw cut over this wire. But note, since the shark screw is to be inserted into the distal part later, the core hole must be one size larger than the hole drilled in the middle phalanx. If a shark screw with a diameter of 3.5 mm is used, the distal drill hole must be drilled with the one number larger drill, the yellow drill. There is no tapping in the distal phalanx. The drilling depth is between 7 mm and 10 mm. Now, screw the shark screw approximately 10 to 12 mm deep into the middle phalanx, depending on the bone quality. Saw off the shark screw so that the distal phalanx can just be placed on the shark screw. By applying maximum traction to the distal phalanx and light pressure with the surgeon's thumbnail on the shark screw shaft, the distal phalanx is placed on the shark screw. By gently rotating the distal phalanx back and forth, the two former articular surfaces of the DIP joint can be pushed firmly against each other and placed under compression, which is held in place by the shark screw. Shark screw thus allows a natural bone bridge on which cells can migrate unhindered. For follow-up treatment, a Stark splint is recommended for 4 weeks. The operated finger should not be loaded for a further 2 weeks.